Welcome. My name is Tracy Terrones, and the population project I am presenting is preventative colonoscopies. According to the Colorectal Cancer Control Program from the Centers for Disease Control and Prevention, colorectal cancer is one of the most commonly diagnosed cancers in the nation. It is also one of the most preventable and treatable types of cancer due to this critical screening. The average risk population of men and women need their first screening colonoscopy at age 50. But if you have family history, you will get it at age 50 or 10 years earlier than when your family member was diagnosed. So if your father was diagnosed at 48, you will get yours at 38. Colorectal cancer is 90% preventable through polypectomy. Of the population 50 years of age or older, approximately 33% have polyps. These polyps have 24% chance of developing into an invasive cancer within the next 20 years if left untreated. In Arizona, nearly 900 people will die from colorectal cancer this year, and only 40% of people over 50 have not had a colonoscopy in the past 10 years. These are useful facts and information to help the public understand the importance of colorectal screenings. Nurse-managed healthcare model expands healthcare access to the community, helps to provide a more complete method to health and illness, decreases racial, ethnic, and geographical disparities in health rank, and lessening the total costs of healthcare in relation to colorectal cancer in the United States. Using the framework of levels of prevention, the screening colonoscopy is a secondary level of prevention with a major focus on health education. This community in southern Arizona, close to the border of Mexico, has the cultural consideration greatly affected by the language barrier, which also involves health literacy or lack thereof. The unemployment rate of 30% and absence of health insurance impedes this community. There are also limited resources for screenings for colorectal cancer in Yuma, Arizona. Men and women 50 years of age and older in Yuma, Arizona, being at risk for colorectal cancer, as evidenced by the statistics from the Cancer in Arizona 2011 Arizona Cancer Registry. Men and women 50 years of age in Yuma, Arizona are at risk of colon cancer, as evidenced by lack of knowledge with colorectal cancer screenings. Community education is a priority for the Yuma area. These community diagnoses will help to meet the objectives for the Healthy People 2020 with preventative care measures. The proposed intervention is public education for this community's diagnosis, encouraging the public to get their colonoscopies through posters, pamphlets, the 5K walk run, and the month of April, as the Get Scoped Awareness Program will assist this secondary level of prevention. Examples of evidence-based research include the CDC's Screen for Life National Colorectal Cancer Action Campaign and Susie's Cause, the Susan Cohan's National Voice of Colon Cancer Foundation. Local health facilities and community sponsors will be encouraged to donate for this cause. Who has access to the information, how they access, and how they are included in the decision making will be considered throughout, especially when asking sponsors for their input. Potential barriers to community readiness would be the stigma of colonoscopies and the embarrassment of going through one. Educating this target population on the importance of colorectal screenings will increase the public's acceptance of this procedure. This is a logic model for the colorectal cancer screening project, the CREASE logic model. Increasing percentages of preventative colonoscopies in Yuma, Arizona, and decreasing the colon cancer deaths of 900 persons per year in Arizona will reflect the difference. Almost 50% of colorectal cancers are diagnosed after the cancer has spread beyond the colon in Arizona. And if the intervention makes a difference, this will help the community and help the goals of Healthy People 2020. Community participation will definitely play a factor in cost methodology and need to be reevaluated. Screening tests such as preventative colonoscopies help find precancerous polyps, abnormal growths, so they can be removed before they have a chance to turn into cancer. This prevents colorectal cancer. Screening also can find cancer early. When treated, it is most effective. However, about 1/3 of adults age 50 or older, about 22 million people, the age group greatest risk of developing colorectal cancer, have not been screened as recommended. Take control and get screened. Thank you very much.